All right, everybody, welcome back to class. We are now at module number 8, childhood mood disorders, childhood and adolescent mood disorders. And I hope that you are doing well. Like I said, now the last couple of videos, we are working our way through, heading into about the middle part of the semester here. And before long, we're going to be done with our class. We have just a few more modules to go. And we come to this module, module number 8, which to me kind of goes hand in hand with last week's module, module 7, where we talked about childhood anxiety disorders. And again, as I said in last week's little mini lecture video, depression and anxiety, or mood disorders and anxiety struggles, really are two separate things, but they often run together and occur together, both in adults and in teenagers and in kids. And so it's not uncommon for us to talk about these two problems together. So we did anxiety disorders in kids and teenagers last week, and this week we're doing mood disorders. Let me kind of talk for a couple of seconds about a couple of words of just quick introduction. Number one, occasionally people are surprised to hear or to think about the idea that kids and teenagers can battle depression or bipolar disorder. And we know that that is true. For a long, long time, people believe that, kids really, there's no way that a kiddo or a child or teenager can be depressed. All teens are depressed anyways, aren't they? That's just kind of a nature, sort of characteristic of being a teenager, is being sad, down, and depressed all the time. And in some ways, low mood and sad mood and irritability, the kinds of symptoms that we see with mood disorders, is somewhat typical in the development of children and adolescents, which is what makes it so interesting and tricky sometimes when it comes to evaluating and assessing kids with mood disorders. But kids do struggle with depression. I don't want to be overly pessimistic. I mentioned this last week, but we live in a world today where we are seeing increasing rates of both anxiety and depression and suicidality in very, very young children all the way through teenagers. Now, at some level, some of that has always been an issue for us in working with kids. But in the last 15 years or so, we've seen just really a gradual increase in that. So we know that it is a real issue. Now, here's again the tricky thing. Sort of like last week, and sort of like when we talked about ADHD, and sort of like when we talked about behavior disorders. One of the things with mood disorders with kids is you have to separate out what is typical and what is normal. And you always have to look at context and environment. Before we start diagnosing or labeling or identifying kids as battling a mood disorder, we always have to look at the child's age and developmental level. What is the behavior that they are engaging in? And is it just outside the realm of typical for what we would consider a child or adolescent of that age or developmental level? And then also, too, we have to look at environment. I'm going to talk a little bit more in just a second about environment, kind of like I did last week with anxiety. We know that kids, again, develop in contexts, and that the environment that they live in, which is also true for us as adults, but especially kids, that the environment in which they live, the family, the neighborhood, the school, their relationships with their peers, that oftentimes that plays a huge role in how they do and how they function and their stability and those kinds of things. So when we talk about mood disorders with kids, it's sometimes tricky. It's tricky because, again, we have to always look at context. We always have to look at what is typical, what is average for the particular kiddo that we're kind of looking at and that we're thinking about. We also know that mood disorders can be kind of tricky for this reason too. We know that kids don't always exhibit symptoms of bipolar disorder and or depression the way that adults do. Now, I give you in the lecture notes this week some information about both major depressive disorder and what's called bipolar disorder. Some of you have already been in your abnormal behavior class, either previously or this semester. And you've already learned probably about the basic symptoms of major depression and bipolar disorder. Those are the two really large, commonly diagnosed mental health conditions that belong to this mood disorder family. And children and teens can experience the symptoms of and be diagnosed with both major depression or major depressive disorder and bipolar disorder. And so I give you in the lecture notes a little bit of a review of just the core basic symptoms of both of those. Major depression is where someone's mood is affected in a negative way to where their mood is low or sad or blue. And so people battle depression. We all know what depression is. And kids can experience and do experience feelings of depression oftentimes, even to the level of like a disorder. Periods of being tearful, sad, guilty, feeling worthless, feeling helpless and hopeless about the future. Lots of sleep problems, sleeping too much or sleeping too little, foggy thinking, physical kinds of pains, lack of interest, loss of interest in things that normally used to interest me. Those kinds of standard depressive kinds of symptoms. And then bipolar disorder, the term bipolar means two poles. Bi like bicycle, bi means two, polar means two poles. And so you know that bipolar disorder is a related mental health mood disorder condition, but it's a little bit different than major depressive disorder. With bipolar disorder, what you have is you have major depressive disorder plus. So you have major depression plus. Well, what's the plus? Well, the plus is not low mood, but high mood, what we call manic mood. And children and teens in some cases can also experience the symptoms of manic mood in addition to their depression. So their mood shifts from low to high, depressed to manic. When people's mood is manic, that's where they feel hyper and euphoric and energetic, and they're kind of loud and they're real impulsive and things, and they have a decreased need for sleep, and everything is great, and at times they can be overly irritable, a little bit aggressive. They can engage in real risky kind of behavior. Sometimes their speech can be real loud. It can be real fast. Those kinds of things. So those are the sort of the typical symptoms of both depression and high mood or manic mood. And those are the two common ways that we see mood disorders or mood disruption in both adults and kids. But here's the tricky thing with kids. Kids really oftentimes, in some cases, kids can have the characteristic, I'm going to call them adult, kind of the characteristic adult symptoms of both depression or bipolar disorder. But what we see also too is a lot of times kids' depression, when they battle depression or they battle bipolar disorder, their mood is manic, it doesn't always look like it does in adults. Let me give you some basic examples. I give you some information about this in your lecture notes this week. So, for example, when kids battle depression, one of the things we oftentimes see is outward behavior that begins to change. Because a lot of times as adults, we're able to cover our depression pretty well. Kids aren't very good at covering their depression or their bipolar disorder. You see it. But what you see may not be what you're looking for. So kids that suddenly have no interest in socializing with their friends, and there's this dramatic sudden withdrawal, social isolation. We see that in adults as well too, but kids especially, that kind of raises a red flag for us that something could be going on. This idea of sort of this immediate sudden desire to socially withdraw, being easily tearful, lots of crying for no reason, getting agitated and angry, and then kind of like a crying jag, we would say, kind of uncontrollable crying, and then they sort of stop real quickly. That usually is kind of a sign that maybe that could be masking, that could be a symptom of, maybe more of a deeper kind of a mood disorder. When kids become overly argumentative and easily irritable, again, it's sort of a change in their behavior, where they have periods where they do pretty good, and then they have periods and days where they just fight you all the time and they won't listen to you at all. And then they do pretty good for a couple of days. And then sort of these patterns that kind of come and go, easy irritability and argumentative. That's sort of an external kind of behavior. We don't see as much of that with adults when they're depressed, but kids will behave that way. And then here's one of the tricky things with kids with both bipolar disorder and major depression is kids, the term we use is kids oftentimes externalize their struggles. The struggle is on the inside, but they externalize it, meaning that it comes out through their behavior. So kids who are fighting, kids who have these anger outbursts, kids who tear stuff up when they get upset. Kind of we saw in the behavior disorders a little bit. And I mentioned depression when we talk about the behavior disorders. Kids, those kinds of things, those kinds of destructive, aggressive, fighting, kind of temper tantrum kinds of things that we see that again. If you've got like a 7, an 8, a 9, 11-year-old and they're still sort of throwing a temper tantrum, that's probably a little old for somebody throwing a temper tantrum. Where they tear stuff up or they fall on the ground and scream and yell or whatever. Kind of a lot of the aggressive kind of things that we see. That's just not typical. And so often those can be symptoms of an underlying depressive kinds of symptoms. And then with bipolar disorder, again, aggressiveness, impulsivity. One of the things, I put a video in your lecture notes this week, and in one of the videos, the person who's talking in the video highlights this trend that we see, and here it is. A lot of times kids who have bipolar disorder are misdiagnosed as having ADHD and vice versa. And so again, I'm not saying that if a kiddo is diagnosed with ADHD, he really has bipolar disorder, but that's a common misdiagnosis. Because when kids have bipolar disorder, sort of like adults when they have bipolar disorder, they kind of look like they have ADHD sometimes. Real impulsive, real loud, have a hard time sitting still, real talkative, can be a little aggressive, a little hyper. And when someone's mood is high and manic, that's kind of how it looks. And so it can kind of get tricky a little bit. So kids sometimes, when kids have ADHD symptoms, a good ADHD assessment is always going to evaluate underlying mood and asking moms and dads, hey, in addition to this hyperactivity, impulsive, having a hard time sitting still behavior, does your son or your daughter ever go through periods where they won't talk to you, where they have periods where they're crying all the time, periods where they're sort of aggressive out of the blue, real short temper span, those kinds of things, which are not typical of ADHD. That's usually typical of something a little bit deeper. And so bipolar disorder, again, and major depressive disorder, which are the two most common mood disorders that we see. It's an easy way to think about and understand mood disorders is to understand those two disorders. We see them in kids, but sometimes it's kind of tricky in how we see it. And I also give you information in your lecture notes this week about what's called disruptive mood dysregulation disorder, which is it's a brand new mental health condition that we have identified, that the field has identified to go alongside major depressive disorder and bipolar disorder. Disruptive mood dysregulation disorder is a child or teen only diagnosis. We do not diagnose it in adults. There are some disorders in the DSM-5 that are adult only. We don't diagnose them in kids. This is the opposite. This is a kids only diagnosis, disruptive mood dysregulation disorder. And I give you some information in your lecture notes about that kind of new diagnosis that now we have at our disposal. This is a kiddo who, again, kind of like with bipolar disorder, we might see, who has patterns of anger outbursts, physical aggression, and periods where in between the two. So they have these regular outbursts, and then in between the outbursts, there's like this mild depression. And so look in your lecture notes and kind of get a little bit more information. Maybe you've never heard of that diagnosis before. It's pretty new. It's called disruptive mood dysregulation disorder. And then last two things real quickly. One of the things that always comes up when we talk about mood disorders in both adults and in kids, but especially in kids, is, well, what's this all about? Why are we seeing so many kids today have all of these mood kind of problems? Well, number one, we know that mood disorders, for the most part, a lot of them are genetic and biological. And so when we see bipolar disorder and we see major depressive disorder in kids, one of the first things we look for is family history, because we know that a lot of times the biological component, the genetic predisposition, the chemical imbalances kind of conversation we've already had a couple of times in this class is often at play when we talk about depression. So that's one thing that oftentimes causes mood disorders in kids. But again, we also know too, second to that is often an overlap. A lot of kids who struggle, especially with depression, bipolar disorder is more biochemical. Depression, major depressive disorder, is both. It can be and is biochemical, but it also too can be environmental. And so we can see, and we do see a lot of depressive symptoms in kids who have grown up and live in chaotic environments, abusive environments, unstable homes. I used to work in the foster care adoption field for many, many years before I came to teach here at the college. And so kids in the foster care system, number one, have experienced abuse or neglect. They're disconnected from their biological families. And then unfortunately, they get kind of moved around a lot in all these foster homes. And we used to see lots of depressive symptoms in kids, unfortunately, in foster care. Even though many of them were being cared for and had loving foster parents, they just had been through a lot in their young lives. And they would have these depressive kinds of symptoms and even these anger outburst kinds of symptoms because of just the environment that they had kind of been living in, and the only world and life that they had ever known, unfortunately. So we know that environment, especially with depression, can play a role, but not always. A lot of kids are raised in loving, nurturing, stable homes, and they still battle depression and anxiety. It happens all the time. So don't be thinking that, yeah, if a kiddo's anxious or depressed, it's probably because mom and dad aren't taking care of him or her the way they should. That's not always true. So keep that in mind as well, too. So we know that genetics and biology often plays a role, but also, too, we know environment plays a role and can and does play a role as well, too. And then lastly, I want you to make sure you look in your lecture notes and the slides this week, the pages in your webs in this module. And I want you just to pay attention to three important related items I mentioned very, very quickly. Number one is substance abuse. A lot of teenagers, especially, not as much kids, not as much 12 and under, more 13 and over. We know with depression and bipolar disorder that is a risk factor. It's one of the risk factors for kids to begin experimenting with substances. Now, that's not the only risk factor, but it is a common risk factor that we see in kids as far as them being drawn to substances is an underlying, undercurrent mental health problem, especially depression and also bipolar disorder too. So you can't talk about mood disorders in kids and not talk about drugs and alcohol at least a little bit. So I'll give you a little bit of information, just a little bit in the module this week about substance use disorders and substance abuse problems in kids and how we oftentimes see that kind of going with mood disorders. One of the things we also do see with depression, especially in kids, is the issue of suicide ideation or suicide attempts. One of the characteristic symptoms of depression is at times people feel hopeless, helpless. They feel emotional pain, physical pain. They feel guilty. They feel that they don't matter, that life is not worth living. And so both adults and teenagers, especially, and kids even too, can have suicidal ideation. Thoughts about wanting to harm themselves are in their lives, unfortunately. And so again, you can't talk about depression and not talk about suicide a little bit. And so I gave you a little bit of information about just the co-occurring, the comorbid, we would say, relationship between depression and suicide ideation. That's also important too. And then kind of related to that, maybe you've heard of this. Have you ever heard of a child who cuts on themselves? The term cutter, a cutter, or someone who cuts, who engages in cutting on themselves. You know, the official term we use for that is non-suicidal self-injury or non-suicidal self-harm. If you've ever worked with kids, um, I worked quite a bit with kids back in the early days of my career, and I had a lot of kids I worked with who oftentimes would take their fingernails and scratch themselves when they were upset, or they would take something sharp, a knife or a pen or something, and they would scratch their skin and kind of hurt to the point to where it bled oftentimes. And it was not an attempt to end my life. It was really just an attempt to hurt myself. And one of the things that I give you some information in your module this week around non-suicidal self-injury is that the most common risk factor when kids start cutting on themselves is depression, almost always. Now, occasionally you have situations where kids will do it for attention. Those kids are really in the minority, though. And the vast majority of the kids I've dealt with who engage in this non suicidal self-harm, they usually hide what they're doing. They don't usually show a bunch of people what they're doing. They usually hide it. And the reason why they hide it is because it's a part of their pain. And it's a way for them to actually deal with the pain of their depression. They don't feel anything on the inside. So they hurt their skin or hurt their body to feel something. That's one thing that we see. Other times, kids who battle depression on the inside, they don't feel nothing. They feel out of control and they feel rage and hurt. And by cutting on myself and I start bleeding, well, then I feel that pain and that rage go away. It kind of soothes me, right? It seems unusual. That would be sort of a soothing coping mechanism, but it's a common behavior that we see in children, adolescents, especially teens, especially who have these depressive kinds of symptoms. So you can't talk about depression, mood disorders in kids and not talk about non-suicidal self-harm in addition to suicide, in addition to substance abuse. I'll give you a little bit of information about all of that in our module this week. Take a look at everything, do your discussion question, complete your homework. We're just going to keep on trucking, and I will see you next time. Have a good week.